again, it does need to be pointed out again and again whenever I say that the opposite is true. It is possible to both tonify and disperse the qi quite well and very tangibly with no qi skill or no needling skill at all. Never need to do any qi work at all. You can tonify or disperse. Easy. Bleeding. Bleeding points or overstimulating a point so the patient is overwhelmed, sweats profusely, and is exhausted on your table, that's dispersing. And it will create a dispersing effect on the body. Spent some time in the mainland clinics, you see a whole lot of that. A whole lot of overstimulation so the patient is exhausted and everything is worn down and out. And then you just have to pray for that poor patient that things rebuild and their true qi was strong enough that when they rebuild, they come back and the illness is gone. Or we could use direct moxa, indirect moxa, needle top moxa. All of these techniques introduce a sensation of warmth that can sometimes be enough to kickstart the yang of the body. Right? Again, you go to the mainland and some of these clinics where there's every single patient has got needle top moxa or getting moxa, and they're doing moxa, 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 moxa. And you realize that what's really going on is that every single person is having their yang stimulated, and the hope is that the yang goes enough, the cycle kicks and kicks out the illness. Fingers crossed, right? You're doing one treatment regardless of what lies down on your table. Or we could learn to practice anatomical acupuncture and only do channel work at points where we know we will hit nerves that create that electrical sensation down the body, which creates sensations of movement for the patient and can and sometimes is the therapy that is needed at that time. But these ways of tonifying or dispersing or channel traveling are very coarse in nature, and they offer no control of the sensations. We could choose how many drops of blood to let out and come up with a theory, 7 drops for this illness and 11 for that. Or how many cones of moxa to use, or how many repetitions of the zings to create, but we can't guide it. We can't expand while we're doing it. We can't lower the intensity, build the intensity, control the intensity, and change the intensity on the fly as we're working. And what's important about that is if we weren't actually doing it ourselves at that moment, we can't undo something that goes wrong. And so if you're just going, and then they suddenly get a spiking headache, you've got no way to undo that headache because you basically did a whole lot and then waited for the response to happen. But if you are creating channel movement and it starts to go up to their head, all you have to do is reverse the channel movement, and you've got all that time because we're moving slowly, and the headache goes right away, just disappears immediately.